My name is Paolo Tizzani. I'm a senior veterinary epidemiologist. I'm working at the WOAH headquarters. The idea of this presentation today is really to provide a bit of introduction on to what is the current status of international reporting on aquatic animal health, and presenting specifically the data collected by the World Organization for Animal Health. Very quick introduction just to introduce the organization for just to provide a bit. The main mission of the organization is really to improve animal health globally. Not going through this slide, but just to say that the organization is old. It was founded in 1924, so it's for the last 100 years we have been really focusing on collecting as much as possible information on health at the international level for the purpose of disease control and the prevention of spread of the diseases. There are different pillars of the organization, that we have 4 pillars, but the one relevant for today's discussion are the 2 that are highlighted in yellow. The first one is really transparency, meaning ensuring as much as possible transparency on the animal health situation at the global level. And the other pillar that is very important is to providing standards. Standards mean, and specifically today for our discussion, is providing standard on animal disease reporting. So how information on animal health should be reported at the international level, and specific information for this disease, for example, about case definition and a specific list of diseases for which international reporting is mandatory. All the standards are in our, let's say, basic test, the code, what we call the code, and the manual. In the code, we have all the standards about disease reporting. In the manual, we have all the standards related to diagnostic test and vaccine available. The information we collect are from 183 members, 24 territories. We collect information on a mandatory basis on 121 listed diseases, 3 emerging diseases. 2 of them are diseases of aquatic animals, and additional 53 non-listed diseases in wildlife. For the non-listed diseases in wildlife, the reporting is mandatory. What is important for us is that out of the 121 listed diseases, 31 are diseases of aquatic animal, and 90 are disease of terrestrial animal. So we have a broadly, out of the 121 diseases, 25% of them are diseases of aquatic animal. Information are collected to our WOAH interface that has been renewed in 2020, and the main purpose of renewing the system was really to try to support as much as possible our members to provide high quality information. Some important point that highlight this slide is really how the reporting international level is done. So an important point is the reporting time. Members can decide if they have really very important information to communicate, they send alert messages. This means 24 hours after disease is confirmed, they should submit an alert. And they should keep the disease event for which an alert was submitting weekly follow-up reports, so to keep the information as updated as possible. And then for the diseases that are more considered like endemic or stable or disease absent, for all the others, they submit each 6 months monitoring report. In the report submitted, there are different information that can be provided. Quali quantitative detail on at least to report what is the status of the disease, present, absent, suspected, and if available, information on the disease impact, so number of cases, number of deaths, etc. Specifically for the specific focus of this meeting, we collect also spatial details, and the spatial details are also a bit connected to how relevant is the event. So for the alert messages and the follow-up reports, countries can provide information at the outbreak level with latitude and longitude. I just provide here a screenshot of, for example, some example of outbreaks reported to the alert messages and follow-up reports. For the rest, they can provide information with different degrees of accuracy. They can provide, if information are available, and this is a quite important point, information at administrative division level with a very high granularity, like from division level 1, 2, or 3. In some case, if they do not have or they do not collect in a systematic way, in an accurate way, spatial information, they can just say the disease is present at the country level. So just to summarize, in the system we have since 2005 218 reporting countries and territory with around broadly 4 million outbreaks reported, but with a big difference, and this is really what I want to focus the rest of my presentation on, with big difference in the capacity of our members to report information on animal health when we consider the reporting on terrestrial animal diseases and aquatic animal diseases. So next slide, I will just guide you to a comparison with what is reported in terrestrial animal diseases and what is reported for aquatic animal diseases in terms of data quality. First of all, we said for important event, the countries can submit alert messages. This graph represents basically the evolution of alert messages and follow-up reports since 2005 until 2021. Just to provide some key example and comparison. On the left, you have the alert messages for terrestrial animal diseases. Just notice the scale. Here we are going from 0 to 2000. And on the right, for aquatic animal disease, we are going from 0 to around 2025. Basically, in the whole period, but you can see the figures below, we are around 4,000 alert messages, and only 5% broadly are reported for aquatic animal diseases. We have around 11,000 follow-up reports, and really a small minority of them are reported for aquatic animal diseases. It's important not only to provide when needed an alert message, but also to provide it on time. And on time, I mean 24 hours after confirmation, the disease should be reported at international level. Same here we have the comparison terrestrial animal diseases, days that a member, each dot represent an alert submitted to us. So basically the days after confirmation that members are needed to report an information at the international level. And here I divided the pre and post pandemic, just to show also the some effect of the disruption of veterinary services in some case. But the big message here is that on this, what you saw here are the median submission time, and for aquatic animal diseases in general, the median submission time is 3 times higher in comparison with terrestrial animal diseases. So less alert messages, less follow-up reports, and more time to report this information. From a spatial perspective, I think, again, this is probably the most relevant also for the discussion today. On this map, you see all the outbreaks reported in 2024, so from January to December 2024, for outbreaks reported to alert messages, with around 20,000 outbreaks. And here the difference is very important. Basically, 99.8% of all the outbreaks reported to alert messages are for terrestrial animal diseases, and you see a very small minority, 0.2% for aquatic animal diseases. Still, for special detail, for other these are for diseases reported to our alert system. If we consider a special detail for diseases reported to the monitoring system, here you see again a comparison between reporting detail for terrestrial animal diseases and aquatic animal diseases. In particular, here I just included the disease for both terrestrial and aquatic reported as present or suspected by the highest number of countries in 2024. So for terrestrial is polypathogenic avian influenza, but you see here we have a lot of details. Each red area represents an area where the disease was reported. On the right, you have the special details that countries are providing for aquatic animal disease, in this case for Bacterochytrium dendrobatidis. And you see the detail is the country, so we do not have further or more accurate detail. And this to say, and to summarize a bit, I think here the key point is really the comparison between the information we are able to collect at international level for terrestrial versus aquatic animal diseases. Different timeliness, different reporting accuracy. We are well aware, WOAH has in 2021 launched an aquatic animal health strategy to improve the reporting for aquatic animal diseases. We also circulated a couple of years ago, and we published the results of a survey whose main objective was really to highlight the barriers to the implementation of aquatic animal health standards. The survey and the main results are available on the website. In general, we saw that there are big differences among the region in the capacity of countries to implement standards, international standards on reporting for aquatic animal health. And we notice a big effect in the lack of proper capacity building, specifically for aquatic animal health. We are working on it to try really to improve in time the collection of information. This was my last slide. I thank you very much for your attention, and I'm happy to take any question in case. And if you even have further question after the meeting, here you have my contact details. Thank you very much.